Welcome to the Reflection Nook for Module 2. If you see below, you'll see a link that'll take you to a blog. The blog is what I contribute to patient care. If you remember when you read your case study, there were specific things that I asked you to look for when you were reading that case study. When you're blogging, what I want you to do is reflect on what you bring or hope to bring to patient care. So if you're not currently in the role you're working towards, such as if you're working towards becoming an RN versus going from an RN to a BSN, you might reflect a little bit differently, and that's okay. So reflect on what you hope to bring to patient care. So talk about your specific role. What is your specific role? What are some specific tasks that you would perform, whether that's starting an IV, whether that is handing instruments to the surgeon. If you're in physical therapy assisting program, it may be that you're establishing a program for Meredith once she's done with her treatments and is starting to build strength. So whatever that may be, specify some of the tasks and give me more than one. Make sure that you elaborate nicely. The next thing you're going to do is talk about potential locations. So you might be a physical therapy assistant and you might work on inpatient rehab, or you may work in an outpatient setting, or you may work at one of the local the wellness centers doing physical therapy there. So tell me where you're providing this care at, because not all care is provided in a hospital. So talk about that. Then talk about other professions that you may encounter when you're providing this care. So if you're an occupational therapy assistant, you might encounter a physician, you might encounter a nurse, you might encounter a dietitian, you might encounter a number of different roles. But every one of these roles, and that's what we're working on strengthening this semester, is every one of these roles has an important part that they play in the care of the patient, and you're going to interact with them. So we're going to talk about in this one, remember, focusing on the me, it's what you bring to the table and the strength that you bring to the interprofessional team, but it's also getting to know some of the other professions that are within that treatment team. If you have questions, please reach out to me. I'm pretty quick on email. That's the best way to get to me. So if you have questions, reach out and I'll be happy to answer any questions you have for you. And I look forward to reading your responses.